Hello everyone, I'm Dr. Ganesh Nagarajan. I'm a director of Gastrointestinal, Liver and Pancreatic Cancer at the Nanavati Max Institute of Cancer Care. I'd like to give you some information today on colorectal cancers in general. Colorectal cancers is a disease which we are seeing more and more of, especially in the younger generation. Previously, we used to occasionally see a young patient with colon cancer, but today, almost 1 in 4 of my patients are less than the age of 40. And this is possibly because of a huge change in our dietary patterns. This is possibly because of a huge change in environmental factors, pollution, and genetic factors. And all these factors put together have changed the epidemiology of colon cancer. Overall, today, one of the cancers where advances have really changed outcomes is colorectal cancers. Many patients of colorectal cancers today have been treated, have completely recovered, and lead absolutely normal lives for decades after their treatment. And this is possible because of what we call as a multidisciplinary team approach. So every patient who comes to us with all cancers, and this is more so for colorectal cancers, is that we amalgamate all forms of treatment: surgery, chemotherapy, and radiation. And a combination of these treatments actually works wonders for these patients. For example, when we talk of rectal cancers, most patients today usually go for chemo-radiation first. Many of our patients present usually with a stage 3 or sometimes even a stage 4 disease. The usual treatment for these is not surgery upfront, but to go with chemotherapy or chemotherapy and radiation, depending on the location of the disease, depending on the extent of disease, the extent of lymph nodes, etc. Various factors will go in. So the entire team of oncologists will get together and decide what is the best course of treatment for this patient. Usually chemo-radiation initially for rectal cancers, sometimes longer courses of chemotherapy, what we call as total neoadjuvant therapy, and surgery comes much later in the treatment protocol. Once the surgery is done, some patients may also require chemotherapy subsequently, and most of these patients have excellent outcomes. In stage 4 colon cancers or colorectal cancers also, even if it spreads to the liver or it spreads to the peritoneum or to the lung, we are able to address these patients with a complete surgical resection, and a good percentage of even these patients with a stage 4 cancer of the colon or rectum will also live long and live meaningful lives.